Welcome to Aging Untold. Today's hip replacement surgery isn't the same as it was 20 years ago. The American College of Rheumatology says about 500,000 are done in the U.S. each year. It's one of the most reliably effective surgeries for pain relief and improved mobility. And thanks to new technology, including AI tools, new techniques, and better pain control, some patients are even going home the same day. Dr. Ray, how do you know when you need hip replacement surgery?
Well, a hip is just one of many joints, and a joint it's meant to move smoothly. But if you think of, with wear and tear over time, then the cushion wears down. And so what was meant to move smoothly, now you're getting pain, it's stiffness, and you have loss of mobility. So those are the things that you have to look at and how are they impacting your life. You see, it's not going to be all of a sudden. It tends to be a continuum or gradual decline and all that. So when you first start having issues, you look at conservative measures, physical therapy, weight management perhaps, and some any anti-inflammatories and all that. And then, when it becomes so debilitating, like if your pain is limiting you, your daily activities and all that, especially sleep, when you can't sleep because of pain, that's a problem. Or when the things that you were doing, injections, medications, when they stopped working, even though they were not the total treatment, but they were working. When they stopped working, then you have to look at what's next. And then when a loss of independence, if you can't get up out of bed or if you can't clothe yourself, then that's a problem. You have to look at all those different things, and then you want to recognize it because you want to look at what your health is. What is my health like? Am I healthy enough to undergo surgery? And what are my goals? What are my desires? What do I expect out of this? So I think you have to look at all those different things.
Yeah. What I see people do is they compare themselves to their friends.
Oh, yeah.
Like, oh, my friend, so-and-so got up and walked the next day and they're 82 and they're using a walker.
Yeah.
And so
Yeah.
I think the danger of comparing yourself is a very real thing.
Absolutely.
And then, looking at your age, your health recovery, what you need to get better and not falling into that trap.
Yeah.
Or someone getting pain relief or using physical therapy and they got better, why aren't I?
Right.
And I think it's not waking up one day and saying, do I want to have surgery? Do I want to have a bionic heart? It's, do I want my life back? Do I want to restore my life and my function? And I think it used to be scary to think about doing this. And now a lot of that fear has been changed because it's so successful. It's no different than when we were young and somebody talked about an open heart surgery. It's like, whoa, you're going to do that? And now they do them everywhere. So hip replacements and knee replacements, these things are happening all the time successfully in older people. And they're now getting to get rid of that pain that's been so debilitating and keeping them from enjoying their life.
And I think a lot of times they think that I can just live with the pain. But what you start to see them do is they start to plan their day around their pain.
Yeah. They're not living anymore, they're existing.
Or not, using it as a reason to not go out and be social and to do things. So here's what happened in my family. A family member with maybe some signs of dementia and not wanting to participate in family activities. And so a dementia specialist, one of the best in the country, said, well, she may be using that as an excuse because she doesn't want to go out. It feels chaotic to her. So she's saying my hip hurts or I have a cold. And if you get hip surgery, that might make her cognitive ability really decline. So I was scared to death that physicians and my family were talking about the hip replacement surgery. But I talked to a nurse friend, so you just have to do a lot of asking questions. And she said, oh, for heaven's sakes, it'll be fine, get it done. And you know what? That was the best thing ever.
It's just one of those surgeries that you can't be afraid of doing what you need to do to regain your life. Do you want it in a pill bottle or do you want it through a surgery where you can get rid of that and you can regain control? And they're happening younger and younger because we're seeing, athletes and people that have been very
wear
physical.
and tear.
Wear and tear, that joint gets worn down and you're not going to replace it. You're not going to fix it.
And don't think you're just going to have surgery. Okay, I'm better. No, you have to do
You
the
have to
recovery.
rehab. You have to rehab. You can't just lay there and, I got a new hip.
Well, the other thing, along with the fear you're talking about, is pride.
Yeah.
I'm not going to take any pain medicine. I'm not going to stay in rehab any longer than I need to. And that's just foolishness.
Yeah.
Maximize your therapy. See what Medicare covers. See what your supplemental insurance is going to cover. Get as much therapy as you can to help you heal faster. And don't don't let pride stop you and it lands you in the bed like you guys were saying.
Yeah.
Right.
I've seen successful hip surgeries and I've seen the unsuccessful where you become bedridden because of that fear of movement and not wanting to deal with the pain. Which pain's worse?
But some
You know?
people, they don't want to take pain medication. I hear it all the time because I don't want to get addicted.
Yeah,
Well,
yeah.
but your body will push you off. You know, you take
Yeah.
the pain medication so that you can do the recovery that you need.
Right.
And your body, as it gets better, you will need it less. It'll push you off.